Welcome to Neighbor. My name is Lynn Corum. I'm your host today, and today my guest is Chris Brown. And we're just continuing our conversations. We've had two great conversations, and this one we wanted to talk about Obamacare. Otherwise known as what? Do you know what we all call it Obamacare? I wonder what the real name is.
Patient Protection and Affordable Care Act, PPACA.
They're going to protect us. And you just, before we just started, you just showed me a little graph. I have it right here. I'll just hold it up for the camera. Of all the people who are going to be involved in protecting us. And we have the Secretary of Health and Human Services is the big dot. Maybe this isn't, we hope this is showing. And the patient is down here in the little corner.
Right down there.
Down here, all by itself, and all these other people.
Yes.
So government, here we go.
Yeah.
So you've explored this. You've always had an interest in healthcare, in the
Yes.
in the single payer debate and so on and so forth. Give us an overview of this 2,000+ page bill. It's daunting, I know.
Well, originally it started out, I think, as an insurance reform law. In other words, it was going to put new mandates on the health insurance companies or health insurance providers, particularly with respect to things like lifetime care benefit limits and coverage of pre-existing conditions and other things, which the law did. And it's made many changes in the healthcare insurance companies and what they can provide and so on. And there are a lot of people who have thought that was a good idea. This is great that I can get insurance now even though I have a pre-existing condition. Okay, but the insurance pools or companies have to somehow get the money to cover those conditions, and the premiums are going up.
And you're covering conditions that people have not paid for. It's like you have car insurance. No, you have a car wreck, and then you get insurance. Or your house burns down, and then you get fire insurance. Is that a fair?
It's not quite fair because,
okay.
But in the case of health insurance, if you go in and are treated for a pre-existing condition and you have a policy, the policy will now have to cover you. Now there are lots of regulations that are coming out. Now there are probably a million pages of regulations that are come out under the various provisions of this law in order to accomplish it. But reading the law is kind of a daunting task. You can get it on the internet. You can go in and you can download it. It's about 1,000 pages.
Well, now accessibility is not a problem, but we even know our own congressman didn't bother to read it too much. So.
But it is, for example, I was looking up a section in the original bill, which was called 1233, Advanced Care Planning Consultation. This was what stirred up so much trouble in the debate about death panels. Now it starts out, A, Medicare, 1, in general, Section 1861 of the Social Security Act is amended, A, subsection S2, and so on, all the way through it.
So you have to cross-reference all back and forth?
So you don't know, you can't go very far without going to the Social Security Act and looking at subsection S2, paragraph DD. And it goes through all this, and so that's part of the problem with interpreting this law is when you go to read the actual law, you don't really know what it says without knowing what all these other sections say. And for example, it goes in, not in here, but in other sections into the Internal Revenue Code, and so on. So you have to know all this before you can come up with a really definitive idea of what the law says.
Doesn't it kind of make you wonder who possibly could have written this?
Well,
and how long it took them? All of a sudden this law is available.
Yeah.
How many years would it take to be working on this behind the scenes?
I don't
and then
know.
just waiting for the right moment to spring it on us?
I don't know.
But it had to be years.
There had to be a lot of thought had gone into this. After all, what was it? We had the Clintons were promoting their health care bill back in 1993 and 94. And so a lot of that must have been included in this, as well as a whole lot of research that Congress had been doing, for example, in investigating various aspects of other healthcare systems and how it might apply to us. But in the middle of that little spaghetti diagram that you showed us is the Secretary of Health and Human Services. And that person has an enormous responsibility under this to determine various provisions of how this law is going to work. I have here a study done by the Congressional Research Service. This is somebody who works for Congress, prepared for members of Congress. It's new entities created pursuant to PPACA. And it goes into a lot of detail about all of the commissions, and it says it requires others to create or authorizes all of these entities. And it goes into, it uses the terms, there is established, there is created, there is hereby created, shall establish, etc., all the way through. And so we have, and then we have all of this details about enforcement. I just pull out one page here of section, this is the final law, section 5101A, National Healthcare Workforce Commission.
Okay.
Comprises 15 members with national recognition for expertise in healthcare labor market analysis. That's the people who actually work in healthcare, who are appointed by the Comptroller General, not the Secretary. This is the Comptroller General.
So the layers are just immense.
And that says location and creation date not specified. What do we do with that? Members of the commission.
Make it up as we go along, you know, I guess.
And Elder Justice Coordinating Council, Advisory Board on Elder Abuse, Neglect, and Exploitation, Federal Coordinated Healthcare Office, Patient-Centered Outcomes Research Institute.
Okay.
And so we have all of these things that are coming, but they haven't gotten here yet. And we don't know right now what they're going to be, what they're going to do, what regulations are going to be issued.
And what they're going to cost.
And what they're going to cost.
All these people have to be paid.
They're all going to be paid per diem.
And they're all good jobs. I mean,
they'll go on forever.
Expensive jobs, and they'll go on forever.
Yeah, they'll go on forever. Now this is where
and they're all at taxpayer expense.
They're all at taxpayer expense.
They're not like they're manufacturing anything. They're manufacturing paper and regulations. Stimulus.
But there are this is just the entities created. If you go into the law, there are all kinds of other things, and I urge our viewers to go into the web and go type in Google Patient Protection and Affordable Care Act, and you'll get I don't know how many thousand hits, but down there you can download the text of this law, and if you care to, you can read it. And but I think it'll be a very daunting task. But and there's a lot of things coming down the road we don't know about. There was just one thing which has stirred up quite a bit of trouble, that the small businesses are now going to be required to file a Form 1099 with the Internal Revenue Service for any expenditure with one person over $600. So that means if your husband's office goes to Staples and spends more than $600, they have to provide the IRS with a document that says, we paid Staples, Brattleboro, Vermont, so much money.
This is so that then I think the federal government is afraid, which they probably should be, because people find ways to get around things, that they're not going to collect as much tax revenue as they're going to need to pay for this.
Probably not.
Yeah.
Well, this has created such a storm that it's very likely to be repealed, this section of it. And indeed, I think that to repeal this law is unrealistic, I think, under the circumstances. What I think is more likely is that they'll go in and pick up these sections and just take them out.
Get rid of some of them.
Because they're unworkable. And they're duplicative. I mean,
Well, we love that in government, though. That's the nature
yes,
of the beast.
This is one of the areas where Congress can save money if they avoid duplication. Of course, that's hard to do, but this is one way that I think they're going to attack this bill.
But there's almost like a paranoia. We pass this, now we know we need this much money to fund this. And so we're going to have the IRS cross-checking everybody in this way and that way, and creating all kinds of paperwork, which is going to cause small business, why they don't like that 1099 for every vendor, is they're going to have to hire a person just to do that.
That's right.
Or they're going to reduce the amount of stuff they get, or only have a few people that they buy from, which will reduce business and suppress business further. So
Well,
either way you turn, it's going to be a problem.
There is an aspect of this law that I think is getting a lot of attention, and that is obviously the cost. It says affordable care, and I don't know what affordable means here, but there is some indication that they're going to take money out of Medicare to pay for this.
But they've canceled that a special Medicare provision people could get, Medicare A, or what was that called?
Oh, there was a special, what did they call it? Advantage.
Advantage.
Medicare Advantage.
Okay.
That isn't what I'm talking about. This relates to the amount of money that people spend in the last year or two of life. Now, as we all know, there is a presumption that we must keep them alive. And indeed, that's a worthy cause. But on the other hand, when you go in and see some of these people that are terminally ill and not likely to get any better, and they're suffering, and yet we do a lot of procedures on them. This has been a subject of a lot of discussion over the years. At which point do you say, no more? We'll give palliative care and hospice care and so on, but we're not going to intervene surgically or something like that. And that indeed was part of the reasoning behind this death panels business that I talked about earlier, which under those terms did not make it into the final law. Nevertheless, in a lot of these commissions that I have indicated earlier are being appointed to determine what Medicare will pay for.
Which does determine care.
Which does determine care. And this is there are a lot of these agencies and panels and commissions that the Secretary is going to listen to that are going to determine things like pain management. Well, they're dealing with painkillers, how many of them you're going to get and under what conditions, with an idea as to how much Medicare would pay for. Well, Medicare determines what a lot of insurance policies pay for. So it isn't just those of us who are on Medicare that are affected by this. It's what does this say to an insurance provider for a local store here? Somebody who gets hurt, and are they going to get palliative care? Are they going to get a surgical intervention or whatever? But that's what a lot of these commissions are going to determine, and the regulations are going to start coming out. And there's going to be a lot of controversy because I think there are some people who are just not going to get as much as they might get now.